Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. And today you're going to learn about screening for different types of cancer, including colorectal cancer, and why cancer screening and other health care is lagging, especially among women in certain parts of our country. Our guest today is Dr. Rajesh Balkrishnan, a researcher at the University of Virginia School of Medicine and UVA Cancer Center. Dr. Balkrishnan, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.
Thank you so much.
So let's start by just asking you a little bit about what made you interested in this type of medicine and this topic.
So, it's sort of interesting. Personally, I think cancer runs in my family. And so I was kind of asked by my primary care physician to get screened for colorectal cancer earlier than what is the recommended age. My mom was diagnosed and successfully treated for stage 1 to colorectal cancer. So, there's a history of colorectal cancer in the family. I've always been interested in doing research related to cancer epidemiology. And I work closely here with the UVA Cancer Center on several projects where we sort of look at issues with screening, with adherence to recommended treatment and survivorship in cancer patients. We also look at geographical differences within the state. We look at populations which are sort of getting access to screening and populations which are not getting access to screening. So a whole host of factors. I think cancer is one of those type of conditions where early detection and treatment is really, really paramount because treatment, again, is successful only if the tumor is detected in early stages. Once we progress to later stages and the tumor has metastasized or spread in the body, then it's very difficult to intervene in the patient. So our goal here at the UVA Cancer Center, and I also collaboratively work with the VCU Massey Cancer Center, is to try to increase sort of preventive behaviors related to cancer as much as we can, whether it is getting screened for cancers like colorectal cancer or breast cancer, or whether it is taking a vaccine like the HPV vaccine, which is sort of the only current true prevention we have for cancer. So again, if a bunch of studies just recently came out and was covered in the news media, we have a big issue with the uptake of the cervical cancer, a very effective cervical cancer vaccine in the state of Virginia as well. 25% of Virginians reported not even knowing about this vaccine, the HPV vaccine. And our vaccination rates are only about 60% of the entire population that could potentially get it. So we have some work to do here. Again, cancer is not curable entirely, and it still remains a big health scare and health problem. And again, it can be treated successfully only if it's detected in early stages. So that is why getting screened for cancer is really important, especially if you have a family history of cancer, if you've had a loved one, and these days it's very, very common to have someone in your family who has had a brush with cancer. So it's becoming more and more common. But again, we have tools with us, very safe tools. We can even with colorectal cancer, for example, we can even do like kind of home-based testing. So people can order home-based tests and send those tests. So there's like a lot of things that can be done. Women can get regular mammograms as a part of their physician visits, annual checkups. So once you sort of hit the age of 50, you have to be a little bit more careful, and you have to kind of put sort of cancer screening also into that pile of other things that you are checked for at your annual wellness visit. With your doctor. Obviously, a lot of this has gone to the back burner because for the last 2 years, we've been dealing with this unending COVID pandemic. So a lot of the other healthcare issues have been relegated to the back burner. But cancer is here to stay. It's not gone away. It's a scourge that has lasted since the existence of mankind, and we still don't have a cure for cancer. So, and the treatments are not easy. The treatments, whether they're radiation or surgery or chemotherapy, all come with a lot of side effects. But there is hope. A few decades ago, a diagnosis of cancer essentially was like a death knell for a patient. But today, that is not the case. However, it is really, really important that the cancer be detected at an early stage, because once it's the cancer has spread or has metastasized, it's not possible to intervene. So again, early detection and treatment is really, really important.
So you're part of a study that found that women who live in the urban and rural areas get screened for breast cancer at similar rates, while rural women get screened for colorectal cancer significantly less than their urban counterparts. So can you tell me the reason for the disparity?
So I think, colorectal cancer, again, is as I told you, breast cancer screening is sort of fairly straightforward with the mammogram, and mammograms have been included as a part of women's checkup with most physicians, even in rural areas. Most of the medical centers are equipped with mammograms, and so again, I think there is enough education, there is enough awareness. There's also like coverage by almost all insurers for breast cancer screening. So
you think it's a matter of access? You think it's because there's a lack of access that there's this disparity?
I think it's a lot of factors, including access.
Okay.
I think it's a lot of factors, including access. There are also there's a lot of issues related to patient education as well. So I think you bring up a good point, which is I think physicians in general, especially primary care physicians in rural areas, are sort of easily bring up the topic of a mammogram and getting screened for breast cancer. The topic of colorectal cancer screening doesn't come up unless and until there is like a family history of colorectal cancer or things like that. So there is some type of, and there is fear, quite frankly.
Yeah.
I mean, the breast cancer screening is not as invasive as the screening for colorectal cancer.
So let's deal with that a little bit, Dr. Raj. I want to know, when it comes down to colorectal cancers, specifically what screening is specific for that particular cancer, and what age am I doing the screening?
Current guidelines from the American Cancer Society recommend that once you sort of reach the age of 50, you need to be screened for colorectal cancer using a colonoscopy.
Okay.
At least once in 5 years, every 5 years. However, if there is a history of cancer, and specifically colorectal cancer in your family, the American Cancer Society recommends that you get screened starting from the age of 45 once every 3 years. So again, the guidelines are a bit different depending on whether or not there is a history of the cancer in your family. So I got my first one at 45 a year ago, a couple of years back, and I'm scheduled for another one next year.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today you're learning about screening for different types of cancers, including colorectal cancer, and why cancer screening and other health care is lagging, especially among women in certain parts of our country. Our guest today is Dr. Rajesh Balkrishnan. He is a researcher at the University of Virginia School of Medicine and UVA Cancer Center. So, Dr. Raj, I really want to make the distinction between colorectal screening and breast cancer screening. So we know the colorectal screening, the gold standard diagnostic test is the colonoscopy.
Right.
Is there any other diagnostic test that would isolate or let me know whether or not I do have colorectal cancer?
So there are home-based tests which are available. They are not confirmatory in nature, but they can tell you if there is a problem and whether or not you need to get a colonoscopy. So there's a variety of them. It's basically what is called as at-home fecal immunochemical test, or the FIT. And there are different versions of this available. That's why I'm not kind of giving any type of names over here.
Okay.
There are different brands which are available, but it's called the FIT colon cancer screening test. So it's a simple, non-invasive way where you basically screen for the presence of blood in your stool to detect early signs of colon cancer.
Sort of like a guaiac test, a stool for occult blood, where you're showing.
Exactly. So it basically sort of like So they send you the stool collection sample kit to your home, and you sort of mail it back. And then, so it is like the FOBT test you mentioned.
So the colonoscopy, a lot of people are scared about that particular diagnostic test because it is so invasive. What can I do? Do I have to get that test done? I know you said 50, 45 for those that have a familial tendency. What does that test involve?
So basically, it is the endoscopic examination of the large bowel and distal part with a camera and a fiber optic camera on a flexible tube which is passed through the anus to get a visual diagnosis of basically whether or not there are ulceration or there are polyps or things like that in your colon. And it sort of gives the opportunity for biopsy or removal of suspected colorectal cancer lesions. So again, it is not an easy procedure because you have to the day before, your bowels have to be completely cleaned out. So for the day before the test, you have to be drinking a ton of fluids that they give you. And then basically you empty out your bowels and go in there, and then in most of the times they give you anesthesia while they do this probe. and they do the scan. So you basically are sort of like kind of zoned out while while the device is examining your colon and rectal areas for the presence of any polyps. So the prep part itself is a bit of an issue, and then the sedation is sort of given, and then the digital rectal examination is done. Again, if there are suspected lesions, then the surgeon can also kind of cauterize it or treat it with a laser light. Basically, they can remove it for the purposes of a biopsy. Mm-hmm. They can also inject any medications there to control any type of lesions, mm-hmm. Which may be bleeding or not. So this procedure takes about 30 minutes or so. And then after the procedure, there's some recovery time for the sedative to wear off. Mm-hmm. And that takes another 30 to 60 minutes. And then most of the facilities will require someone to come with you to take you back home. So because the patient is still a bit groggy and from the sedation that has been given to them. So it's really
diagnostic, I hear. Yeah. So I saw an article you posted about how some blood pressure medications may help with colorectal cancer survival. Can you talk about that?
Yeah, this is a very interesting finding. So we have I have been doing some work with a lab at the University of Sao Paulo in Brazil, which works with animal models, and they found some protective effects of essentially these antihypertensive medications. They seem to sort of interfere with the tumor mucosa and sort of like kind of prevent the mucosa, they kind of prevent the tumors from spreading. So we kind of looked at actual patient data from Medicare enrollees, and we found a similar type of protective effect of these agents in patients who were diagnosed previously with colorectal cancer screening. So it seemed that the use of some of these agents prevented the tumor from spreading and improved survival in these patients. Now, of course, those findings are pretty preliminary, and they have to be verified using larger clinical trials and so on and so forth. But there is increasing evidence to show that there are medicines which seem to interfere with the tumor vasculature and sort of prevent the tumor from spreading. And commonly used antihypertensives like ACE inhibitors and diuretics may actually interfere with the tumor vasculature and prevent the spread of the tumor.
So that's specifically for colorectal cancers.
It's for the gastrointestinal tract specifically. So it is basically the medication going into the tract and then sort of interfering with any tumors that are there in the tract.
So you talk about the colonoscopy as being one of those diagnostic tests for colorectal cancers, and you also speak about the mammography as one of the gold standards for breast cancer. What about prostate cancers? We know that all these cancers have some diagnostic tests that are surrounding them. Talk to me about those. I know that you already spoke about mammographies and how necessary they are. What is the age?
For mammography, also, it is recommended. Again, the mammography is not the definitive test to detect the breast cancer. It is the first step It can detect potential tumors or tumor-like growth in the breast. This has to be confirmed with a biopsy.
Correct.
So again, but the biopsy is fairly easy to do. It's not as invasive as a colonoscopy. So the tissue samples can be collected pretty quickly, and then and then done that. So it is recommended that women. I mean, again, it's sort of like kind of depends on your family and the history of breast cancer in your family. I think it is recommended that if there is a history of breast cancer in your family, that women, starting from the age of 40, start receiving mammograms. So I think it is also recommended that women perform breast self-exams to sort of see if there is any to see if there's any abnormality that they can detect, which then they can bring up with the physician, who will sort of kind of decide whether or not a mammogram needs to be taken, especially if the woman is below the age of 40. I think women who are aged 40 to 44, it is totally up to them whether they need to start annual breast cancer screening. Once you reach the age of 45, the American Cancer Society recommends that a woman should get mammograms every year until the age of 54. Once they get to 55, and if nothing has been detected until then, they can switch to getting mammograms once every 2 years, or can continue yearly screening. It is totally up to them. But majority of these, but from the age of 45 to 54, it is recommended that women get screened annually and get their mammograms annually.
So you talked about biopsy, and you said that for both the breast, the mammography, that, you need the biopsy to definitively say this cancer. Similar to the colonoscopy, you need the biopsy. What is a biopsy?
So the biopsy basically is where the sample of the tissue is taken from the area where there's suspected to be tumor. It is basically the sample cells or tissues are examined for to determine the presence or extent of the tumor. So basically, the tissue is examined under the microscope by a pathologist, and basically it may also be analyzed chemically, but it shows you whether or not the cells are regular cells or are cancerous cells. So a pathologist makes that determination whether or not the cells seem to be cancerous in nature.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and our guest today is Dr. Rajesh Balkrishnan. He is a researcher at the University of Virginia School of Medicine and UVA Cancer Center. I know you talked about breast cancer and a little bit about colorectal cancer. Now the prostate cancer, how is that detected?
So basically, the prostate cancer is detected using a specific test, which is called as the PSA test, or the prostate specific antigen test. And this is sort of recommended for men. If you're between 55 years and 69 years, I think you need to talk to your physician as a part of your annual visits, and the physician may, depending on your family history and so on and so forth, they should talk to. So if you are at average risk for prostate cancer or increased risk of prostate cancer, if you have some symptoms of prostate cancer, there are some symptoms of prostate cancer include things like difficulty starting urination, weak or interrupted flow of urine, frequent urination, especially at night, difficulty emptying the bladder completely, pain, burning, concerning, especially if there's blood or urine in the or semen in the urine. You have painful ejaculation. These are potential signs of prostate cancer. So, and most of the prostate cancer cases are detected between 55 years and 69 years. So 55 to 70 is the age at which they are detected. So I think if you are showing some symptoms of prostate cancer, you need to talk to, and you're 55 years old, or at least 55 years old, you have to talk to your physician about getting the PSA test, the prostate specific and antigen test. Again, the risk of prostate cancer is much higher in African American men compared to any other demographic. Yes. So I think if you're an African American male aged 55 years or older, or if you have a family history of prostate cancer, and if you are experiencing some signs and symptoms of prostate cancer, you must talk to your doctor about getting the PSA test. So basically, the PSA test essentially also involves ultimately doing a biopsy, again, if the PSA test shows any abnormality, then you can then the biopsy will be done, and then potentially you would be treated with either surgery or radiation therapy, or some other treatments which are still sort of being explored, like hormone therapy and so on and so forth.
Dr. Raj, I really want to first thank you for this research that you've been doing and that talks about disparities. What is the one thing you want to leave with us when it comes down to disparities and when it comes down to healthcare in urban and rural communities?
So
how can we fix this? Yeah.
So again, yes, we have done many studies where we basically have shown there are systemic disparities are a part of this. This is one of the biggest problems with the healthcare system, is the uneven quality of care, and also major social issues like structural racism, other types of socio-demographic urban-rural divides that exist in providing care, and this is especially, I think, we have shown that. This is especially pronounced in cancers like prostate cancer, which you mentioned, which is shown to have higher incidence in African American men, yet it is significantly underdiagnosed and undertreated. Mm-hmm. So I think we need to increase education, especially amongst communities which feel marginalized, which there is a history of basically distrust with the medical profession. These issues should be addressed. So I think we need to work with communities to engage community leaders, and even if it means working with, and this is something we are doing at the UVA Cancer Center, we are working with community church leaders, and other type of organizations to try to improve awareness related to screening, as well as treatment options that are available for cancers.
Well, we really appreciate your work, the great work that you're doing, and we want to thank you for being here, Dr. Rajesh Balkrishnan, a researcher at University of Virginia School of Medicine and UVA Cancer Center. We hope you stay safe and continue to do the great work, and thank you for being our guest today.
Thank you so much. It was a pleasure.
Yes. This is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. And we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to WHPC@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the Nursing Department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.